Good morning, everyone. Welcome to Lenox Hill Hospital's interview day. It's really lovely to get to virtually meet you at least. My name is Sarah. I'm one of the current chief residents, one of the fourth years here at Lenox Hill. So almost on my way out, but hopefully can help guide you guys through some reflections that I've had over the past 4 years and explain a little bit about our program and who we are. First of all, I just wanted to start off by congratulating all of you for making it to this point. Medical school is no joke. The residency application is certainly can be grueling and intense. So you should feel very proud of your accomplishments and sort of what you've been able to succeed thus far. It is a huge milestone, so you should definitely give yourself a pat on the back. In the next 20 minutes or so, I'll go through our program, a little bit about who we are as residents, as faculty, as administration, a little bit more in depth about our schedule so you can get a general sense of what our interns, PGY2s, 3s, and then of course 4s are participating in and what level of experiences they all have. And then of course, if there are questions, feel free to raise them at the end, but you can also save them for when you have more intimate one-on-one interviews with the faculty and the residents. So feel free. There will definitely be time for questions. So just to dive right in, so our chair is Dr. Frank Chervenak. He joined us in 2018, so just when I was was starting as well. It has been a very successful and productive relationship. Dr. Chervenak is very established and credited within the realm of obstetrics and gynecology. He's a trained maternal fetal medicine specialist by way of Yale University, and he spent a lot of time as the chair at Cornell and New York Presbyterian prior to joining us in 2018. Dr. Chervenak is also a very prolific ethicist. And so he helps guide us through multiple ethical dilemmas that present themselves in the world of obstetrics and gynecology, as you can imagine, can be quite a few, and hosts monthly chairman rounds where we discuss research articles and ethical papers with him. Our program director is Dr. Dee Katz, who came to us by way of LIJ. She is also the director of minimally invasive surgery in our department of gynecologic surgery at Lenox Hill, and has really been able to bring a very high call volume of minimally invasive and robotic procedures and surgeries, including all major and minor surgeries here at Lenox Hill. So it's been a very beneficial relationship to have her both on the administrative side, but also on the surgical side as well. She's the director of benign gynecology as well. We have 3 full-time maternal fetal medicine specialists, Dr. Ron Bornstein, Dr. Shane Wasden, and Dr. Megan Savage, who's the newest, who just joined us this year. Pictures pending, I guess, but hopefully she has a nice photo shoot coming up. They run our high-risk maternal fetal medicine unit. It's called Black Hole Sonogram Unit, which is affiliated with Lenox Hill Hospital. So the majority of our obstetrical patients are seen for both routine and non-routine sonograms, as well as higher counseling for riskier pregnancies. They also lead us through weekly antepartum rounds where we discuss the inpatient services, where they help us manage these patients and guide their treatment successfully. We have 2 full-time GYN oncology staff, Dr. Janine Villela and Dr. Elena Pereira. They have been with us for multiple years, which has been a very enduring and successful relationship. They bring a very high volume of GYN oncology cases to our small but modest hospital, so we can really operate on par with some of the bigger centers and the bigger academic universities that are in the Upper East Side and New York City as a whole. Dr. Villela is also the director of GYN oncology. They have a very robust practice, and we get to participate in their office hours, as well as first assist on all of their cases. No GYN oncology fellows from the greater Northwest system rotate here. So really as a resident, you're the first assist, and as you become a chief, you will be able to successfully do the majority of the case with them. As I mentioned before, benign gynecology is run by Dr. Adi Katz, who's our director. She also is trained in minimally invasive surgery and has really brought a robust service to Lenox Hill Hospital. She's also, we're very lucky as our program director to help us navigate, life through residency, and she's very hands-on and very approachable. I think you all will be meeting with her today, so definitely keep an eye out for that. Some of our faculty, we have 2 full-time faculty practices that are growing every day. The first practice is run by Dr. Asaf Ferber and Dr. Lisa Johnson. Their partners are Dr. Abdul Karim and Dr. Gadomski, who are recent graduates of Dr. Gadomski came from Lenox Hill Hospital and Dr. Abdul Karim came from Maimonides. They've been excellent additions to our faculty practice. Faculty, for just reference, and there's a few others that I'll introduce in just a moment, are the providers who help and assist us in the resident women's ambulatory clinic. So these are run predominantly by residents, and these are our resident patients, and which are overseen by a faculty member on any given day, which I'll get into in just a moment. They also have their own patients and their own panel, in addition to the patients that we take care of at the resident clinic that help bring a high volume of obstetric and gynecologic cases to the hospital. The other practice is with Dr. Catherine Rutenberg, Dr. Louise Chu, Dr. Palak Oza, and Dr. Camille Riccardi. They are the second faculty practice who also help us run the resident clinic and have their own patients as well. In addition to the faculty practice that help, guide our education in the clinic, we also have 6 full-time safety officers. These are providers who it is their job to help us manage the hospital at any given time inpatient. So whether we have patients on the obstetrical floor who may have come from an outside facility or an outside hospital and they want to deliver here, or they had an emergency, they're from out of town, whether it be obstetrical or gynecologic, they don't necessarily have an established provider here. The safety officers are the ones who are hands-on with the residents, evaluating the patients, helping the residents come up with treatment plans, and then of course executing those plans, whether it means that the patient requires a delivery for an obstetrical emergency, or requiring going to the operating room for gynecologic emergencies such as ruptured ectopic, ovarian torsion, and things like that. We certainly have our high call volume of we call like non-affiliated patients, so patients who decide to come get care on any given basis at Lenox Hill Hospital. And we are very, very lucky to have these 6 providers, Dr. Karamitsos, Dr. Kayan, Dr. Phillips, Dr. Parkajanis, and Dr. Raffaline, hopefully some of whom you guys will meet today, to help us navigate these cases. I will say one of the things they are exceptional at is really allowing the residents to have their own autonomy with these patients. So these patients are really ours, in addition to, of course, our clinic patients, but helping us use deductive reasoning and clinical skills and judgment to really approach a patient as a whole. They help sort of as a guidance or as a resource per se. And of course, if they don't agree with the management plan or they think that something should be altered, they will definitely vocalize and verbalize that, but they really want these patients to be handled and managed by the residents, and it's definitely felt and definitely contributes to our education. Just a little bit about where we are. We say we're on the Upper East Side. We mean it. We're on East 77th Street in Lexington, for those of you who are familiar with the grid, but it's the true Upper East Side, circa Gossip Girl, I guess. There we are on the map. We're very close to Central Park, which you can see, which is beautiful. We use that as a outlet for sure for wellness days and walks and time off from the hospital. We definitely are able to have the opportunity to explore Manhattan as a whole, and now especially that things have reopened because of COVID. I will say that our patient population varies dramatically. So of course, we do have women who are localized and centralized in the Upper East Side, but we do have patients coming from all 5 boroughs. We are also very conveniently located on top of a subway stop, a very popular subway stop on the 6th. So we do actually have patients who just get off the subway from wherever they may have come from and just walk right into the hospital for care. So it's a wide and very diverse patient population. That was something that actually I was pleasantly surprised about when I started here at Lenox. So just a few more like pictures of the main entrance. So Lenox Hill is an established hospital. It's been around for many, many years. I think it was founded somewhere in the 1850s. So it has beautiful old buildings combined with new buildings. You'll definitely get a feel once you come here, or if you come here, for sort of the old and new marriage that is Lenox Hill. We have some beautiful rooftop gardens you can see in the top right. And then, of course, it's just my secret plug because Amanda Lowe Richardson was my chief when I was an intern. We are on Netflix. So if you guys want to see a little bit more about labor and delivery, definitely check your look at the Lenox Hill docuseries starring Amanda. And you can keep an eye out for me because I had one line, but I won't tell you where it is. But they briefly cut me out. I looked at the camera way too much, so I didn't make it in that much. Oh, perfect. So Lenox Hill is a 652 beds, very specific, tertiary hospital. It was founded in 1857, so I guess I was close. It's highly regarded as one of the nation's top hospitals. We keep getting ranked as one of the top 5 hospitals in New York by U.S. News World Report, and that was as of last year. We also were the most recent winner of the Women's Health and Excellence Award and recipient of the Health Grades Maternity Excellent Care Award. So Lenox Hill keeps getting recognized, and here we are. This is our award for the U.S. U.S. News National Award. So who we are as a whole. So Lenox Hill is now affiliated with Northwell Health. This is the largest health system within New York. So if you are all interviewing at other places in Manhattan or the other boroughs, Long Island, Staten Island, for example, you might see our logo, the Northwell Health with the triangles. Probably doesn't say Lenox Hill Hospital, but it will probably say a different hospital. Being under that umbrella, honestly, has really bolstered our academics in ways that I'm so pleasantly surprised about. The transition happened right before I joined my intern year. Just by virtue of having more exposure to a robust database. Having the entire Northwell Health System database at your fingertips really helps improve research and improve power of our studies. We have a wonderful relationship with the Hofstra Northwell School of Medicine. So our medical students and PA students come from there, and it's been a very rewarding relationship, I think, on both ends, as well as just having the ability to participate in more simulations, more research days, more protocols as an institution base has really improved our obstetric and gynecologic care at Lenox Hill Hospital. So a little bit more about our residency. So we're a fully accredited 4-year program, which I think is pretty standard for an obstetric and gynecologic residency. We have 2 campuses where we perform patient care. One is the main, which is Lenox Hill Hospital. That's where our labor and delivery unit is. That's where our main operating room is. That's where all of our major cases for gynecology occur. And we also have Manhattan Ear, Eye, and Throat Hospital, which is very cutely named MEAF. Not to be alarmed, we're not doing anything ENT related, but that's where most of our minor cases are done: hysteroscopies, DNCs, polypectomies, and actually now transitioned to having some laparoscopic surgeries there as well, cystectomies, and then some robotic surgeries, endometriosis excisions, and things like that. That's located on 63rd and 3rd. So it's a really easy and beautiful walk, honestly. Maybe not so much, and it's, the dead of winter in February, but for now it's excellent. And it's a good way to get out and stretch your legs if you're bouncing between the main and MEAF. We have been very lucky to have exceptional placement of residents into all subspecialties, including MFM, REI, urogynecology, minimally invasive surgery, GYN oncology, and family planning. This year, out of the four graduating chief residents, 3 of them are going into fellowship. So it's been very consistent and very on par with what our match rates have been in the past. Usually we'll say it's about a 50-50 balance between those who want to be a generalist versus those who want to subspecialize. And this year, everyone who wanted to matched. You can see some photos. These are our current senior residents of both the PGY3s and PGY4s. So what about our clinical experience? So our overall numbers from last year, of course, these are constantly evolving. We had 4,200 deliveries. And for GYN, we had 1,900 outpatient surgeries and 700 inpatient surgeries, including major cases. Like I mentioned before, our patient population is quite diverse. So 55% are actually from the neighboring boroughs, the Bronx, Queens, Brooklyn, Long Island, and even neighboring states for people who are out of town, and 45% that come from Manhattan. And obstetrics. I believe there's a tour, hopefully later on, that you guys can get a general sense, but we have 12 labor and delivery rooms with 3 operating rooms devoted to just OB on the 6th floor of the main hospital. So 6th floor is where that's our home base. It's where labor and delivery exists. It's where postpartum exists. It's where our antepartum unit exists, and it's where our resident like call room and work rooms are as well. So when we're not in the operating room or we're not actively delivering patients or, of course, participating in patient care and labor and delivery, the 6th floor is sort of where we call home. We have a very beautiful and new obstetrical evaluation suite or triage, which I think is again pretty standard and is run by residents. They're the forefront of all patients who present to triage for multiple obstetrical issues. And then our antepartum unit as well, which is our inpatient or our annex for high-risk patients. These patients are managed by residents with the aid of one of the 3 maternal fetal medicine specialists who help guide their management and their care. And then, of course, postpartum as well. We have 3 designated wings, which are high-risk postpartum unit. They get a little bit more one-to-one nursing care, and they require a little bit more attention, of course. Our low-risk unit, which are for our very benign and very non-urgent postpartum patients in our executive suite as well. We have a level 3 NICU that is staffed by phenomenal neonatologists who actually we enjoy working with tremendously. They're always willing to educate and share, and certainly are very active and participate proactively in patient care. For our GYN division, on the 10th floor of Lenox Hill Hospital, we have 22 main operating rooms that we share amongst general surgery, urology, neurosurgery, et cetera, and 2 very large PACUs. These are where our major GYN surgeries take place. GYN oncology, urogynecology, REI, our big minimally invasive surgeries. With Da Vinci robotic surgery, we have a simulator for education and also dual console. Residents are encouraged to complete a module training session that once they are done, by the time they're in their 3rd or 4th year, they can sit on the dual console and operate robotically. And of course, laparoscopy. At MEAF, that's where our ambulatory procedures happen, as I mentioned before. And MEAF is also affiliated with our IVF center with Dr. White and Dr. Maxwell. So ancillary support that we have 24-hour in-house anesthesia attending coverage on OB, which is extremely helpful. They're extremely knowledgeable, not just about obstetrical anesthesia, but about postoperative complications as a whole. And they can definitely help guide us through some very murky and tricky situations, especially if we have takebacks, if we have postpartum hemorrhages, cesarean hysterectomies, urgent and emergency sections for like cord prolapse or things like that. And then like any normal hospital, we have phlebotomy and EKG and transport. We do have pet therapy to some extent, but COVID, the dogs couldn't come. So hopefully they'll be back by the time you guys match. We have phenomenal nurses. I know that people probably say that everywhere, but one of the things that I really have been so lucky to have here at Lenox Hill is how incredible our labor and delivery nurses are. Some of them have become like very near and dear friends. They really watched us sort of grow up. They're extremely knowledgeable. They are extremely willing to educate. I remember as an intern, they would be, the ones who would really help me kind of in my first few months navigate even like where to get supplies. They're always willing to be a part of that. They care fiercely for their patients, and if you are able to help kind of cultivate a good working relationship with them, it will be long lasting. That would be one of the things I recommend, no matter where you guys end up is, the nurses are an ally, and to really help kind of you succeed is to maintain a very lasting and loving relationship with them, which I hope to do when I graduate as well. We're also very lucky to have our OBGYN PAs, who are also a group of wonderful women. They've joined us from all over. They're very experienced. They are the ones who are responsible for our protected time. So when we're in lecture or didactics or meetings or grand rounds, everything runs smoothly and effortlessly because of them. They help us manage both services, both obstetrical and gynecologic, and they are all trained to scrub. So if there are C-sections that are going during protected time, they will participate in those. If there are GYN cases that we might need an extra set of hands, we don't have necessarily someone to cover, we can add on from the emergency room, they're able to do those as well. They also have a slew of knowledge from their experiences and are very willing and interested in teaching as well. I think Lauren Jeffrey was the one who taught me how to place a cook balloon. So, it's skills like that I use every day that I attribute to them. Our residency clinics, I alluded to a little bit, is run exclusively by residents and is overseen by a faculty attending on any given day. So it's run Monday, Tuesdays, and Wednesdays. On Wednesdays, it's split. So the morning is booking clinic. So that's where we book our GYN cases with Dr. Katz. And then followed by high risk clinic on Wednesday afternoon. So that's where the antepartum resident, which I'll get into shortly, will see outpatient high risk patients that are exclusively belong to the residents under the supervision of one of the maternal fetal medicine specialists. 2 residents go on any given day with 1 attending overseeing. We have state-of-the-art sonograms there. Really, that was exciting to be able to diagnose my first early IUP at like 6 weeks. That was a very big deal for me. And we have in-office leaps that we can do. We do all small procedures, so colposcopy, endometrial biopsies, ultrasounds, lab work, everything is done there. The residents really run the show. And so I think that's very unique to our experience and to our residency at Lenox Hill. So all the lab work, all the blood work, all the imaging, anything that's really ordered and worked up for these patients needs to be followed up and evaluated, and patients have to be contacted by a resident. So it really gives this honest and real feel that these patients belong to us. And yes, of course, we're never alone. We're always being overseen by an attending and can help manage the patients. But there's a real feel to having ownership of the care of these women, which is very special and very educational. So our lovely first years will be second years by the time you guys arrive, but David, Rosalie, and Yael, they have come from all over, including Israel. They're lovely and we love working with them. Their schedule is as follows. So if you're a new intern, they do 3 months of OB days where they're responsible for running labor and delivery. They're the primary on all vaginal and uncomplicated C-sections. They're the first face of the triage. So a patient comes in for a slew of obstetrical issues and sometimes not even obstetrical issues. She just happens to be pregnant. It's the intern's responsibility to evaluate and triage these patients appropriately under the direct supervision of a senior resident. They also do 3 months of OB nights, which is a similar scenario in terms of the level of patient care and the level of activity that they're participating in. However, it's done at night. They do 2 months of postpartum work. So that is a fluctuation of helping cover OB, so helping cover labor and delivery as needed, but also we do have, can have some very complex and sick postpartum patients. And so they're that point person to help establish whether they have postpartum complications, whether it be anything ranging from preeclampsia, which is, and chorioamnionitis, which are very bread and butter, to things like takebacks to the operating room, cesarean hysterectomies, ICU admission, things like that. They also get 3 months of GYN. This is where they're responsible for all minor gynecologic surgeries. So we really get our interns in sort of at day one, both an OB and GYN. We're of the nature you have to, I guess, crawl before you can walk. So once you really master the hysteroscopy, you master the DNC, you master a suction for a missed abortion or a miscarriage, you can then progress to walking, including open cases and laparoscopy. So we really want our GYN interns to have exposure to the main ORs upstairs as well as beneath, in addition to helping the residents cover the GYN service, the floor patients, those who are admitted. They get 1 month of surgical ICU experience as well, which is on the 8th floor, which is extremely rewarding. It really helps kind of develop clinical judgment and skills under the direct supervision of some of our intensivists, which is invaluable. And then sonogram week, they have at Blackhall unit. This is where interns learn how to do biophysical profiles, establish fetal weight, and things like that. Those are skills that they bring back to their time on OB. Our second years, which is an extremely lovely group of people, Eugene, Samantha, Macy, and Eugenie. Here's some photos of them out and about, and I guess at work, which is not really out and about. But when you're a second year, the training sort of shifts towards management of the high risk obstetrical patients. So when you are a second year on labor and delivery, you are the antepartum resident. You are in charge and under the supervision of maternal fetal medicine, really responsible for taking care of our inpatient antepartums. You're also responsible at that point for doing the more repeat cesarean sections, the more complicated C-sections, and getting more exposure in that realm. When you're on GYN, you are the point person between seeing emergency patients, so patients in the emergency room, whether with menorrhagia, severe vaginal bleeding, ovarian torsion, ectopic pregnancy, patients that are sent in from the office for a slew of gynecologic emergencies as well, with an additional focus on GYN surgeries. So this is where you really graduate to start doing laparoscopy and laparotomies as well. When you're on nights for your 3 blocks of nights, and these don't also, just so you guys know, happen consecutively, they are split up. So you don't get caught up with sort of like, the monotony of 3 months in a row of nights. So that does not happen. But you are in charge of the GYN service, the floor patients, as well as the emergency room under the supervision of a 4th year resident. You have 2 months of primary care and subspecialty. So these are a little bit more time while you help kind of manage a little bit of GYN. You also are more exclusively working as an outpatient and doing outpatient procedures as well. And then 1 month of REI at our IVF center at Meath, which is extremely fun. Our fearless 3rd years, Michelle, Leroy, Kevin, and Ariel. It's been a tremendous pleasure getting to be seniors with them this year. I've really enjoyed working with all of them. They've really come into their own. When you're a 3rd year, you're a rising senior at that point. So it's really more about acquiring skills of management. So when you're doing your 3 months of OB days, you alongside a 4th year are running an active labor and delivery unit, and then managing a very complex GYN service as well. You do inpatient GYN consultations when you're in your 3 months of GYN, and when you're doing your 3 months of nights, you're the point person running the labor and delivery floor on nights. For GYN surgeries, you've really started graduating to the major cases. So laparoscopic hysterectomies is where you start actually getting to perform them, not just manipulating the uterus, if you guys remember as students, and starting to do more advanced laparoscopic surgeries, and hopefully also getting on the robotic console. We also are doing more open cases, more laparotomies with our GYN oncologists as well, and our benign gynecologists. You also have the opportunity for 1 month of an elective rotation. This can be anywhere between a research month if you need more time to conduct more research, to going away on away rotations to other hospitals for additional exposure and experience. And then you have our chiefs. That's us, me, Rachel, Ashley, and me. We'll be gone, but hopefully you guys will be meeting us sometime today. I promise we're nice. And we really enjoy each other, as you could tell. Really, once you become a chief, I think this is pretty standard across the board for OBGYN residency, but you're really in charge. You're the person that attendings go to for trouble. You're the person that your junior residents go to if they have questions or need assistance. You're in charge of really running day-to-day and monthly operations on labor and delivery, on both the GYN, benign GYN, and GYN oncology services. And really, you're at the tip top of your surgical experience and getting high complexity surgeries. We're also in charge of more administrative responsibilities, so helping formulate our education schedule and exam reviews, case assignments for GYN surgeries, team specific like bulletin reviews, organizing drills and simulations, as well as conferences as well. A few like where are they now, just if you guys are curious. So last year, actually, all of our graduating residents wanted to go into private practice, and they did, except for Dr. Godowski's faculty practice. The year prior, we had two, it was that 50-50 I described, so two going to fellowship and two going into private practice. And the year prior, we had three going to fellowship, the three who wanted to, with one going into private practice. And this year, the fours that we discussed, 3 out of the 4 of us desired fellowship, and we all matched. So what does our day-to-day look like? And again, everything changes, and things can be different. We have daily didactics from 7:30 to 8:30. This is what I alluded to as our protected time. So we come in, we take sign out for the services you're responsible for. The PAs then kind of hit the floor and manage everything. We're not to be disturbed. These are presentations and demonstrations both by faculty members, by private attendings who are volunteering their time, as well as resident peer education. It's very comprehensive lecture series across all subspecialties. We also have journal club, we have chairman round, we have ethics rounds. These are all things to help us feel a little bit more well-rounded and not necessarily pigeonholed into just doing practice bulletins all day. We then also have weekly department conferences. These are usually on Wednesdays, grand rounds, and then case conferences, M&M, both obstetric and gynecology, that are led by the 4th years. And then skills training gets sprinkled in. Sometimes it happens at the 7:30 marker on the mornings, but sometimes it doesn't. And again, these are all protected. We have CLI, which is part of the Greater Northwell system. So it's actually really nice to join residents from other Northwell institutions for continued learning. These are skills and drills and simulations that are done together in a simulation center down in Long Island. We also have laparoscopy skill lab, and we have in-services for MyAssure, Ethicon, and Explanon, and then OB drills that are done on labor and delivery, like shoulder dystocia, PPH. Those are particularly fun because we, as residents, don't necessarily know when they're happening. They're run by our safety officers, and they'll actually call a code overhead and just have the residents respond, and the nurses as well, and work as a team to kind of get through the simulation and the drill safely. Just a little bit of pictures of us doing particular activities. So we have suturing lab with pig's feet. We also have a laparoscopic pig lab as well that we can see down below. GYN, M&M, and then every year we also have residents participate in ACOG District 2, that's the district that we're part of, lobbying in Albany for particular interests of the district at that time. So when Ashley and I went pre-COVID, it was lobbying for certain insurance modifications to allow our patients to have safe deliveries. This is just a little bit of the weekly itinerary that we sort of touched upon, but sort of what didactics happen on certain days. And again, these are usually from 7:30 to 8:30. Fridays are exclusive for antepartum rounds, where one of the maternal fetal medicine specialists come and we discuss the entire service led by the antepartum resident. It's very educational. And of course, like any other residency program, we wouldn't necessarily be able to finish out the presentation without discussing resident wellness. We have a dedicated wellness resident who is responsible for activities throughout the year, including wellness days that residents are allowed to take that allow us to, take care of ourselves in ways that we may not necessarily have the opportunity with a grueling residency schedule. So to have someone who's really responsible for that is very important. We attend each other's weddings, we attend each other's birthdays, we find time to see each other outside of work. We go to SNL together, we go on trips together. A few of us went to Miami before, when COVID was better and we were vaccinated. We go out and celebrate the end of Creogs at a ping pong bar, which is always a really big hit. It's been like 4 years in a row. I just really genuinely enjoy each other. I think one of the things I would say, and it's hard in the realm of virtual interviews, but is to really try and get a feel for the residents and how they interact with each other, how they interact with the staff. Residency is hard, no matter where you go. It's sort of, that's the nature of how medical training is. And you really want to ask yourselves, like, can you see yourself spending time with these people, long weeks, long days. We still want to hang out with each other after work. I think that's like a very telling sign about how much we enjoyed hanging out with each other, but I'll leave that up to you guys. So, it's easier just to kind of sit here and say it on a computer, but really look for that, because I think education can be standardized, right? You'll really get the opportunity to be a well-rounded resident with competent skills and a majority of the programs I'm sure you're interviewing at. But really look to see if these are people that you can spend time with and enjoy working with and hanging out with outside of work. So I'll leave you guys to that. It was a pleasure getting the chance to talk at you, I guess, through a screen. Hopefully I see some of you during the interviews. I'll be around. Feel free to email me. I'm sure Shoshana will send my email out at the end of the conclusion of the day. If there are any questions or any concerns, please let me know. Take care.